Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program.
Hello and welcome to the latest episode of Inside 340B Report. I'm Shannon Young, an associate editor and senior writer at 340B Report. Today I'm joined by Will Newton, who is also an associate editor and senior writer, and Bella Czajkowski, our national correspondent. Will, Bella, thanks for being here.
Thanks so much. Looking forward to it.
Thank you.
Before we get started, I just want to make a note of our format change. We're no longer offering a video component to this podcast, but fear not, we've still got you covered on everything you need to know about in the 340B world. You just won't see our beautiful faces, but you can listen to us. So let's dive in. Will and Bella, want to share what's on our plate for today?
Yeah, definitely. So even since our last podcast episode, there has been a ton of state legislative activity. We're now up to a total of 13 different states that have enacted 340B contract pharmacy access laws, 5 of which have done so in 2025, including several states just in the past week. So going to give an update there. Also going to talk about a pretty important court ruling that happened in Minnesota related to that state's existing contract pharmacy access law, as well as a significant move that the state of Arkansas took toward enforcing its contract pharmacy law. Bella, how about you?
Yeah, we also have some major shifts at the federal level, including with the Department of Health and Human Services, which announced restructuring and layoffs recently at the agency, which is important because it could mean potentially moving the 340B program from HRSA to CMS, the jurisdiction from HRSA to CMS. And speaking of CMS, there's also an update, of course, that there is a new CMS administrator.
So it sounds like we're going to have a full plate here today. So let's dive in. Will, can you tell us a little bit more about the state contract pharmacy access bills that we now have?
Yeah, definitely. So as I said, 5 states in 2025, which are South Dakota, North Dakota, Nebraska, Utah, and New Mexico, have enacted laws that prohibit drug makers from placing contract pharmacy restrictions in those states. So today I'm going to focus mainly on the Utah and Nebraska laws because those are the first 2 ones to take effect. So Nebraska's law actually already is in effect because the law said it takes effect immediately upon passage, and the passage happened a couple days ago. And Utah's law is going to take effect in a couple weeks on May 7th. The other 3 laws that I mentioned are taking effect later in the summer, or in the case of New Mexico, next year. So the Nebraska and Utah laws, there's actually already been 2 drug industry lawsuits challenging those laws. And what's really been sort of interesting and stood out to me in covering how those bills got enacted is the governors in those states acted very differently. So the Nebraska and Utah bills themselves are pretty similar in that they both prohibit drug maker contract pharmacy restrictions, including claims data requirements. And they're also pretty similar in that both state legislatures, which have large Republican majorities, pretty overwhelmingly passed them despite a dark money ad campaign, which we've discussed at length before on this podcast, targeting both of those bills with misleading and false claims about the 340B program. But when those bills actually got to their respective governors' desks, the governors acted pretty differently. So in the case of Utah Governor Spencer Cox actually allowed that bill to become law without his signature, meaning he did not sign it, but he also didn't veto it. In making that announcement, he sent a short letter to the state legislature basically saying that he appreciated their support for the bill, but he thought that the 340B program should be addressed on a federal level. And he also outlined some concerns he had about whether or not 340B discounts were effectively benefiting patients. So while the governor did say that and did express those concerns, obviously the state Senate and House apparently didn't have them because they passed the bill with near unanimous support. But, the governor registered his slight objections and allowed it to become law. In Nebraska, it was very different because there is this huge signing celebration and ceremony specifically focused on the bill that happened earlier this week, where the governor, a number of bill co-sponsors and state legislators and state providers and provider advocates all kind of came together to celebrate the bill, to sort of tout the importance of the legislation and the 340B program in the state. And also a number of them sort of spoke about how they had pushed back against misinformation campaigns targeting the bill. So very different responses in both of those states, even though both obviously are ultimately laws. So it'll definitely be interesting to see how things play out in both of those states, particularly now that the attorneys general there either, are tasked with enforcing those laws and defending them against drug industry lawsuits, which there will likely be more in addition to the other two. And then finally, I just wanted to quickly note that the New Mexico law, even though it doesn't take effect until January of next year, is pretty interesting and unique in that it applies only to community health centers, so only FQHCs and FQHC lookalikes. So of the 13 states that have passed contract pharmacy access laws, New Mexico's is actually the only one that only applies to a subset of covered entities. So another interesting development there for sure.
So we also had major updates on lawsuits challenging Minnesota's law and separately Arkansas officials enforcing that state law. Can you tell us a little bit about that, Will?
Yeah, definitely. So in Minnesota, there was a pretty important judicial ruling in that a federal district judge dismissed 2 drug industry lawsuits challenging that state law. But the reason that the judge gave for dismissing those laws was that there wasn't really any enforcement mechanism in it. So the judge essentially said that the drug makers didn't have legal standing to sue the state over the law because there was no threat of enforcement because there's no real enforcement mechanism in the law. So those lawsuits are thrown out. And this stems from sort of the unique way that Minnesota's law is written. So unlike most of the other state contract pharmacy access laws, Minnesota's law doesn't have an enforcement provision. It actually, at one point during the legislative process, did have an enforcement section in there, but that was amended out of it. And so even before this judge's ruling, there were sort of some concerns among some providers and other attorneys that this law was written more weakly and wasn't really as strong as most of the other existing laws out there. Minnesota's law also expires in 2027, although state lawmakers this year have introduced a new bill that would extend that. So this is definitely a very notable development in Minnesota. It is important to realize, though, that the ruling there doesn't really have any effect on the enforceability or the constitutional arguments related to any of the other state laws in courts. So, but still, notable nonetheless. And then the other big development that happened at the state level was in Arkansas. So Arkansas, as many of our listeners know, was the first state in the nation to enact a contract pharmacy access law. And in March of last year, the Eighth Circuit Court of Appeals, Federal Appellate Court, upheld the constitutionality of Arkansas's law against a drug industry challenge, and the Supreme Court declined to take up that challenge. And so after that pretty significant court decision, pretty much every major drug maker, announced that it was going to exempt Arkansas covered entities from its contract pharmacy restrictions, except for the one holdout had been AstraZeneca. So AstraZeneca sued the state in a separate lawsuit right after that, and the state itself had been sort of working to enforce the law against AstraZeneca. And in order to enforce the law, you have to go through sort of an extended trial-like state administrative proceeding where AstraZeneca can respond to allegations, et cetera, et cetera. Anyway, long story short, the Arkansas Insurance Commissioner just the other week issued an order finding that AstraZeneca had violated the law and ordered AstraZeneca to restore 340B discounts in the state. AstraZeneca shortly thereafter complied and announced that it was exempting providers in the state from its restrictions. Although I should note that the company, in a comment to us, basically said that they still maintained that their restrictions were compliant. So definitely a pretty significant update there.
Yeah, well, thanks for that update. Seems like you've been very busy lately, so appreciate it. Before we turn to what's happening at the federal level, let's take a moment, though, to hear from one of our great sponsors.
Verity Solutions is a proud sponsor of 340B Report. In today's dynamic landscape, having the right solutions and a dependable partner is more vital than ever. Verity's innovative, award-winning 340B program management solutions are designed to optimize your 340B pharmacy spend and maximize your pharmacy supply chain savings. Verity is dedicated to helping you find new program opportunities and streamline workflows, resulting in more resources to enhance patient care. Visit Verity340B.com to start your journey today.
Bella, since our last podcast, the Senate has confirmed Mehmet Oz, also known as Dr. Oz, as the new CMS administrator, a position which currently will allow him to interact with the 340B program in an indirect way. You covered Oz's confirmation hearings. What do we need to know about this key cabinet post?
Yeah, so I think it's safe to say most people would agree there's a lot to know about Oz. But as it relates to 340B, the Senate backed him as Trump's pick to lead CMS with a 53-45 vote. Republicans largely supported the nominations and Democrats opposed it. The Senate Finance Committee voted 14-13 along party lines to advance his nomination originally on March 25th. So as CMS administrator, Oz is going to oversee Medicare and Medicaid. He will not have direct control over the 340B program, which is actually housed in HRSA, but there is a significant interaction between 340B and the Medicare and Medicaid programs, of course. And perhaps most importantly, CMS is responsible for implementing Medicare drug pricing negotiations under the Inflation Reduction Act, which is, of course, a program with multiple direct interactions with the 340B program. We've been listening very carefully, watching very carefully for Oz to take a stance on 340B, which he has not yet done so on 340B generally or on its interaction with the IRA. But 340B report did break the news earlier this year that Oz was listed as a co-founder of a health benefits company, ZoroRx, and that company offers 340B hospitals a unique opportunity to generate substantial revenue while improving patient outcomes. End quote. ZoroRx also lists Oz's son, Oliver, who is also at the confirmation hearing, as a founder. So, like I said, we're keeping a close eye on what role Oz will play, if anything, on the 340B front.
Yeah, and it's also really important talking about this to note that Oz took control of CMS while some pretty significant changes are happening at HHS. So Shannon, can you tell us a little bit more about what you're hearing there?
Yeah, so as I'm sure most of our listeners know, HHS saw some major changes in the last couple weeks. The agency announced a major restructuring at the end of March that included plans to consolidate divisions, create a new one known as the Administration for a Healthy America, or AHA, which is sort of a play on the whole Make America Healthy Again slogan that Robert F. Kennedy Jr., the HHS secretary, has been banding about as part of the Trump administration. The restructuring also included the elimination of 20,000 full-time employees, about half of which were fired in the past week or so. And the others are sort of being made up out of early retirements and things like that. As part of those firings, we saw hundreds of jobs lost at CMS and HRSA, which oversees 340B, the Office of Pharmacy Affairs, which houses 340B specifically. We don't know exactly how those cuts have affected that office quite yet, but we don't believe that they were really affected because it is such a small office. And another noteworthy thing is that while CMS doesn't currently have much oversight over 340B, that could soon change. We've heard rumors circulating in the past couple of days, especially about efforts to move 340B from HRSA to CMS. And a lot of the chatter about it is that it would make a lot of sense with all of these changes we're seeing under the IRA. You know, it's sort of a divisive issue, I guess, but there is a thought, well, there are going to be areas of overlap, you know, especially with the drug price negotiations, especially drug makers have brought up the IRA in their lawsuits challenging HRSA's opposition to their rebate model. So we're definitely keeping an eye there. We don't have a ton of details on what that would look like. The staff at HRSA would be expected likely to move over to CMS with the program. So we're not expecting a major upheaval there if this shift does occur. But otherwise, things, as far as we know, are operating as normal for 340B at HRSA right now. We're in the middle of a quarterly registration process for covered entities. That seems to be going normal. Audits are coming back. Sources have told us that they're getting communications with the agency in the office. So it doesn't seem like it's had a major effect yet. But again, we are not exactly sure what the timing of any potential move could be if the 340B program is shifted out of CMS. RFK Jr., the secretary, was asked to speak before a congressional committee this week, and that hearing has been delayed. It's unclear at this point when that will happen or if it will happen, but whenever he does, we will hopefully get more details on everything that's going on with this upheaval.
Yeah, definitely a ton to keep track of, and we are religiously following everything happening at the 340B level, on the federal level, at all of the states, and all of these court cases going on. So you'll definitely be hearing from us a lot more on all of these topics with news alerts and our regular issue. But with that, I think we're going to go ahead and wrap up this week's edition of Inside 340B Report. Our fearless leader, Ted Schlafsky, was not able to join us this week as he was out of the office, but he looks forward to joining us for our next episode. And we just want to thank all of our sponsors and all of our listeners for tuning in. And we look forward to our next episode of Inside 340B Report coming up pretty soon. Thanks, everyone.
Yeah, thank you.
The 340B Report is your indispensable source for news and intelligence on the 340B program. We are pleased to offer a special discount of 25% off for first-time subscribers. Go to the subscribe tab at 340breport.com and use coupon code podcast25. I know you will find our news service to be a valuable investment. Thank you.